Veronica, another question regarding misperceptions. This virus will cause autism. This virus will change my gender. This virus will make me infertile. All of these things. Can you please group them in one answer?
I'll try to group them in one answer. The autism question is one that we have gotten for years. So just so everyone is aware, in 1998, there was a study released and conducted which suggested a link between vaccinations and autism spectrum disorder. This study then underwent further inspection and has since been retracted. It takes a lot to retract a study. The provider's medical license was taken away due to falsified information. Since that study, this link between vaccination and autism has been debunked in over 25 other studies that disproved a connection between autism and especially the MMR vaccine, which is implicated. There was even a study of over 95,000 children, with nearly 2,000 of those children considered to be even at risk for autism because they had an older sibling already diagnosed with autism. And that study confirmed that the MMR vaccine did not increase the risk for autism spectrum disorder. So this is something that we're still hearing in the popular media, and it unfortunately came from falsified information. In terms of infertility, in general, vaccination and looking at prior vaccines, again, we don't have data for obviously the mRNA vaccines, but looking at prior vaccines, little to no vaccine components can reach the ovaries or testicles in general. As Dr. Haney mentioned earlier, when we were discussing this, those are often called sanctuary sites in our bodies. They're very protected because they contain our reproductive genetic information. So, that would be extremely unlikely to happen.
Okay. I'm going to start moving to another batch of questions that came now. And again, anyone can answer, please, because we did not really look at these questions beforehand. One of the questions is probably still related to Cecilia and Veronica. I got hepatitis B and I developed severe arthritis after I got it. I'm very concerned if I take this vaccine that I may have maybe an immunological response that results in, let's call it severe arthritis. Is that possible? Should I be worried?
So I can try to answer this question. So there is an entity called serum sickness, which is a different type of immune reaction. It's not an allergic reaction per se, that can happen with things such as Hep B or the Hep B vaccine. It has been implicated as well. And serum sickness involves when the virus or an antigen, so an antigen is something that leads to production of an antibody. It pairs up with the antibody, and that complex can float around in your bloodstream and get stuck in your joints and cause other really inflammatory types of components in your bloodstream called complement to come to the site and cause inflammation. That is what serum sickness is, and the Hep B vaccine has been linked to it. What we know is that the phase 3 Pfizer trial included people with Hep B and C, and they did not have any serious adverse events. What we also know is that the Hep B vaccine is a different type of vaccine altogether from the Pfizer or Moderna mRNA vaccines, and those contain inactivated Hep B virus. And we know that serum sickness is linked to the size of the antibody and antigen complex. So we think that larger complexes have a higher risk of causing serum sickness, which is what you're describing, this arthritis, joint pain that happens after a vaccine, or even some drugs are implicated. It needs to be a large size component. the very small mRNA component, which is, again, like Dr. Cecile said, in the nanometer range, is very small. It's very different. So in the end, we don't know. That could be a possibility. But in general, serum sickness is a very low prevalence in the general population. And it's probably very low risk in the mRNA vaccines. But again, we have limited data.
Dr. Cecile, speaking about the nanoparticles, some claim that they are harmful to those with Alzheimer's disease. Do we have information?
I don't have any information about nanoparticles being harmful to the people with Alzheimer's disease. I did read something about targeting medicine to the brain in Alzheimer's disease via targeted nanoparticles. So nanoparticles are actually used to treat some brain injuries, like Alzheimer's and other diseases. But I did not see anything about nanoparticles really causing or anything to do with Alzheimer's in terms of causing basically harm.
Thank you.
But again, that's all I know about that.
No, perfectly. It's unknown yet. I urge you to from now on, let's try to be concise because we're getting a lot of questions. The next question is probably Nardine's, but if anyone wants to help out, I'm going to group two questions together. Is the vaccine safe for those who have health problems, anemias, diabetes, asthma?
Actually, those would be the top priority to get the vaccines because those are the known risk factors for the disease itself, for having severe disease. So yes. Actually,
according to the guidelines of CDC, immediately after the frontline doctors, nurses, technicians, there will be the elderly, and soon after will be those who have comorbidities like the heart failure, kidney failure, asthma, diabetes, because those get very bad COVID. The question to
may add, I'm sorry, Dr. Hani, if I just may add something too, those high-risk patients, if tested positive for COVID and they received the monoclonal antibodies, it's recommended to wait 90 days until the vaccine. So I just thought it's noteworthy to put this out there because the monoclonal is a new modality we have right now, also under emergency use authorization, whether the bamlanivimab, the Lilly product, or the Regeneron, the antibody cocktail, as they call it. And if any of those patients with high risk and positive COVID received it, will be entitled in 90 days, which is probably okay because by the time the vaccine comes to the general population, it'll be around then anyway.
Okay. The next group of questions, Veronica, are really related to are all ingredients similar from the ones from USA and China? And also, if you can be kind enough to answer, why do one vaccine has to be stored in dry ice and the other doesn't have to be?
So I presented the Pfizer and Moderna vaccine components or ingredients, and I do not know about the Chinese vaccines ingredients. So I wouldn't be able to answer that part of the question. In terms of why one needs to be stored at a lower temperature, that has to do with the different stabilizers, pH stabilizers, the salts used. So they use different lipids and salts, and the Moderna vaccine, those components allows it to be stable at a temperature of just -4 degrees, whereas the Pfizer components need a lower temperature for stability.
Okay, thanks. Dr. Cecile, I think the question is trying to say, when do I become immune, or do you expect me to become immune after the second dose? Is it next day, or how does it work?
No, probably someone else can answer this question.
Okay,
I don't
Veronica?
have information about this one.
Or Nordine, do we have in the phase 3, when did they test the antibodies?
Not specifically when they tested the antibodies, but based on the graph of the positivity of the COVID, the positive COVID itself, they noticed from the graph that I showed earlier that about day 12, there was some partial improvement in the numbers, and the actual number, their primary endpoint, was 7 days after the second dose. And I believe the only reason it's not really based only on testing the antibodies, and Veronica can correct me if I'm mistaken, because it has both the B cell and the T cell immunity, like we spoke earlier. So it's not really only the antibodies, but some CD4 cells as well.
The next question, I'm going to try to answer it, but please correct me. Can the vaccine be offered to multiple myeloma patients? And I'm going to generalize it for any cancer. As long as their white counts and neutrophils are normal, and the doctor considers them a high risk to become COVID positive, unfortunately, cancer patients, whether myeloma or other cancer, when they get COVID, they're really, really very sick. So although we don't have data, unfortunately, this is a very common answer we say to every question. So please do not be upset from us, but we are trying to be very, very scientific and do not try to hedge or give you educated guess. But willing to give you the vaccine. The next question, I think also to Veronica, how the dilution is done with Pfizer vaccine. What is it possible to increase the diluent to the extent that becomes more diluted and I get less than what I'm supposed to get?
So I'm not a pharmacist, so I'll answer to the best of my ability, but there is a protocol for how to give anything, any vaccine, any IV solution. So I guess it's possible if they are not following the protocol that it will be too dilute. However, there's a certain protocol, there's a certain number of doses that come from each vial, and they're following a certain protocol with adding the right amount of saline or whatever diluent it is to the actual vaccine itself.
Okay, the next question is simple. We answered it before. If I have pulmonary embolism, yes, you can take the COVID vaccine because actually you are immune competent and you actually, hopefully, God forbid, you don't want to get COVID. The next question is about penicillin allergy. Is that you also, Veronica? Will answer that. Is there any problems taking the vaccine?
No, there should not.
Okay, I'm sorry, I have to go fast. So unless you want to add any more answers, just no. So you can take vaccine even if you are penicillin allergy. How long would the immunity from the vaccine last? We answered that question. Unfortunately, we do not have data today. The data is being collected. There is already 170,000 people immunized in the last week in the States. Almost all of them are nurses and physicians. We will know maybe in a month, in 6 months or so. So unfortunately, we don't have an answer. Is that vaccine coupled with the 5G thing that they talk about these days? Is that a link for tracking patients and that vaccine? Okay, Dr. Cecile. And while we are talking about it, let's bring the out there just to finish with it. The idea of the chip, can they control us? Can they put an electronic chip in that vaccine and they control us?
I don't know if they can or not, but basically they don't have anything like that in the vaccine. I mean, they published, Nardine and Veronica told us about exactly what's in the vaccine in terms of salts, in terms of, adjuvant, everything what's in the vaccine, they told us. So there is nothing about, the chip or anything like that, or controlling us or anything like that. I mean, this is definitely fiction.
Yeah, unfortunately, this is a lot of misinformation happening there. Let me say it this way, there is nothing like that scientifically found that is going to be tried on human beings. I think the idea makes what is written in Revelation 13 about that you have to have the the beast sign, and you cannot sell or buy without it. So people use this vaccine as the idea of Bill Gates have done it, and many governments have done it to control us. So far, although the idea may be plausible, but not for this vaccine. Maybe one day that will happen and we should resist it, but across all governments, it's not in this vaccine. Can a patient with liver transplant receive the vaccine? And of course, he's taking or she is taking anti-rejection medicine. Who wants to take that?
So I think it's kind of repeated that how those patients were not included in the study. So it's going to be a risk-benefit assessment. But even that risk-benefit assessment, the thought about immunosuppressed patients, not that they will get sick from the vaccine because it's not a live virus, it's not an attenuated virus. So the concern is really we don't know what kind of immune response they will mount to the vaccine. We're not sure how much T cells and B cell immunity they will be able to mount from that vaccine. But obviously, it's something they will have to discuss with their transplant physician as well.
The next question, I'll answer it fast. Is there any information about younger than 18 years old? Both studies did not include less than 16, one 16, and Moderna was 18 and above. However, there are already a parallel study going on, and we will know very soon. The name that was brought in today, Dr. Jordan Orange, mentioned that he will vaccinate children. He has no problem vaccinating children, and he thinks that children are just small adults and there should be no bad effects on them. He's the chairman of the pediatrics in Colombia, so he's not just a small authority. However, we don't have data as usual, but I can tell you physicians will be more able to do that once we have more studies. Again, there is repeated questions, Veronica, about autoimmune diseases and can the messenger RNA interact in a way with the DNA and cause problems in the future. Dr. Cecile, I think you brought that earlier. If you want to reconfirm.
Well, for the sake of time, we said it before, but basically the messenger RNA gets degraded right away. There is no chance really, or for it to go inside the nucleus or do anything like that, interacting with the DNA.
And not to repeat the point again, but somebody's asking, can I get cancer from RNA?
Cancer is basically mutation in your DNA. So since we're saying it's very unlikely that this would happen, then definitely also unlikely for cancer to happen.
I want to confirm something. Please correct me if I'm wrong. Dr. Cecile mentioned it and showed it in a nice slide. The messenger RNA does not stay in the nucleus, does not enter the nucleus, and it's not long lasting. Am I right in this?
Yeah, it's made in the nucleus and then it gets out to the cytoplasm.
Exactly.
Once in the cytoplasm, it makes the protein and it gets degraded.